Snowstorm appearance seen in a case of uterine fibroid. This case was that of a 45-year-old parasis whose last childbirth was 6 years prior to presentation. She presented with a 3-year history of abdominal pain and swelling. On abdominal examination, the uterine size was equivalent to 18 weeks. She was asked to do a pregnancy test after the first ultrasound diagnosis of molar pregnancy. The PT was, however, negative. So this is a transabdominal video. Let's see what made the sonologist arrive at diagnosis of a molar gestation. As you can see, the bladder is not full, vaginal stripe. All right, hemorrhagic cysts. You can see part of the endometrium here. So note this area, which fits the typical description of snowstorm appearance. That was why the patient was requested to do a pregnancy test following an ultrasound diagnosis of molar pregnancy. Note the myometrium here. The difference in echogenicity between the myometrium and this lesion, which is actually a feature of degeneration and a uterine fibroid. Again, note the endometrium here, and note that this lesion is fundally located, vaginal transverse section, the hemorrhagic cyst. And look at the endometrium here, look at the fundus here, and look at the fundal location of the solitary uterine fibroid, and not the difference in heterogeneity between the myometrium here and the degenerative changes in this uterine fibroid. So remember, uterine fibroid has peripheral flow, or can have both peripheral and central flow if the fibroid has undergone degeneration. So here you can see these are part of the aqueous vessels. This is the myometrium, and note the clear demarcation between the myometrium and this lesion. So in the circumferential flow to the fibroid here, and asagi anteriorly, this is it. So this was the large fundal fibroid that had undergone degenerative change. In fact, it was soft in consistency. Posteriorly, you can see the ovary here, the tube, and the fundus somewhere here. So this was what was seen on ultrasound scan with features of degeneration. So after myomectomy, the patient was 45 parasis. She was cancelled for hysterectomy, but she declined. So we respected her views and offered her what she wanted, which was a myomectomy. After the myomectomy, not this.
Why is that? Yes, sir. Have you started the video? Yes, sir.
So look at the inner contents.
Snowstorm. You see that? That's how it's better at the sound.
So here I just compared the notes. The differential diagnosis of snowstorm appearance on ultrasound would be molar pregnancy, miscarriage, degenerative uterine fibroid, and choriocarcinoma. So this was a 40-year-old You can see a typical snowstorm appearance with thicker uterine cysts. This is the same case. Just comparing it with this 18-year-old who had a repeat evacuation, and histopathology confirmed that this was a case of choriocarcinoma. There's an 18-year-old, thicker uterine cysts, okay, typical snowstorm appearance. This is our index case, the case of degenerated uterine fibroid. So one can see that at times it's difficult to differentiate between this, and this. But of course, history and appropriate assessment of the patient will actually narrow down diagnosis. So here, the typical snowstorm appearance. Look at the bisected specimen at surgery. But for us who do not live in cold climates, what resonates better with us maybe honeycomb appearance rather than snowstorm appearance. So thank you very much for listening.